I'm Brenda Pavlik-McGowan, Master's of Nursing student at Roberts Wesleyan College in the Nursing Administration and Leadership program, and I will be discussing the impact of the nurse leader on interprofessional collaboration, also known as IPC. The need for interprofessional collaboration on a national level began when the Institute of Medicine first discussed the advantages of team-based care along with interprofessional education back in 1972. More recently, the passing of several acts of Congress, including the Patient Protection and Affordable Care Act of 2010, continues to acknowledge the importance of interprofessional collaboration. IPC occurs when multiple health workers from differing professional backgrounds work closely together with patients, families, caregivers, and communities to deliver the highest quality of care possible. It's based on the concept that better care, improved safety and outcomes, and a better patient experience can be expected when providers consider each other's perspectives, including that of the patient, so that unified, continuous, and reliable healthcare across all settings is the end result. Each of the health professions must shift its focus from operating from a silo position towards partnership and sharing. In this transformed healthcare system of sharing, nurses are an integral part of the team, as they are uniquely positioned to be able to view the patient in a holistic manner, especially when permitted to work to the fullest extent of their education and training. Nurses have a broad knowledge base and routinely interact with colleagues across the disciplines. Specifically, nurse leaders contribute to the development, implementation, and ongoing improvements in policies and processes, encourage collaboration across disciplines, and are skilled at the translation of evidence-based practice into the clinical setting, while applying critical thinking skills to develop relationships and solve problems. The Institute of Medicine report of 2011 regarding the future of nursing suggests that nurses are needed in these leadership positions in order to contribute their unique perspective and expertise on such issues as healthcare delivery, quality, and safety. Nurse leaders' abilities include the skills necessary to drive innovation at their organizations. These changes will require a new or enhanced skill set on wellness and population care, with a renewed focus on patient-centered care, care coordination, data analytics, and quality improvement. The education of master's prepared nurse leaders encompasses these required skills. There are many significant healthcare concerns today which emphasize the need for IPC, concerns of which the nurse leader can participate, supporting the principles of IPC. One of these concerns is for the anticipated shortage of healthcare providers, including physicians and nurses. The demand for nurses is expected to exceed the supply by the year 2020. Nurse leaders are needed to optimize nurse retention through the creation of positive practice environments, which includes IPC. As per the report by the Institute of Medicine in 2011, The Future of Nursing, effective workforce planning and policy making will entice workers to healthcare organizations. This will require better data collection and an improved information infrastructure, which can be facilitated by the nurse administrator. The nurse leader is able to encourage collaboration in order for all disciplines to work more efficiently and effectively as a team. Another healthcare concern that can be addressed through interprofessional collaboration is the changing demographics of our country. Nurses consistently approach care in a holistic manner, inclusive of patients, families, and communities, and encourage the empowering of patients in their care to assume responsibility for self-management. Patient demographics are changing as racial and ethnic minorities represent the fastest growing population in the U.S., facing more barriers to care. The population is aging as baby boomers continue toward retirement. The number of patients living with chronic disease continues to rise. As patients transition out of hospitals, nurse leaders have both the clinical and management knowledge and skill set required to assume key coordination roles and to assist the tracking of outcomes as a measure of effectiveness. Nurse administrators will lead and participate in ongoing improvement to ensure excellence while promoting teamwork. The need to contain healthcare costs is yet another healthcare concern which require all healthcare professions to work together to function more effectively in order to keep costs down. Nurse leaders are trained to gather, track, and clearly communicate key clinical metrics and financial data over time and across settings, including at the individual and population levels. Successful IPC reduces the cost of readmission rates, improves quality care, outcomes, and reduces spending, especially attributed to unnecessary hospitalization, unnecessary emergency room visits, repeated diagnostic testing, repeated medical histories, and adverse drug interaction. As a member of the interprofessional care team, the nurse leader is engaged in awareness of healthcare costs and can guide the team to value-based practice. My proposed evidence-based change is the implementation of a nurse-led, non-pharmacologic, evidence-based delirium bundle to the surgical intensive care unit in order to increase the prevention, recognition, and effective treatment of ICU delirium. Success of the project will be dependent upon a multidisciplinary approach. The interprofessional team chosen for the implementation of the evidence-based bundle include all members of the nursing staff who perform direct patient care, unit management and leadership, all levels of providers, respiratory therapists, pharmacists, physical therapists, and patient family members. Each of these team members are represented in the various components of the ABCDEF delirium bundle and must be involved in the project for positive results to be achieved. A consistent, continuous, and unified approach is needed to combat ICU delirium. As this is a nurse-led initiative, nursing is essential to all phases of the project. Nurses will be instrumental in the onboarding of the various disciplines of the team, the teaching of their colleagues, the implementation process, the evaluation process in conjunction with the information technology department, the sustaining of the project through interdisciplinary rounds, and continued education and communication of results at the unit, service, and hospital level. Collaborative strategies will be utilized in the design, coordination, and evaluation of the patient-centered outcomes of increased effective screening of delirium, decreased incidence, and decreased length of stay due to delirium. Such strategies include defining clearly objectives and goals, onboarding of the team to build trust and open communication through effective meetings with other disciplines, including in large and small group meetings, valuing the diversity of the members of the team in their unique perspective and multidisciplinary rounds where an interprofessional team, including the patient's family, will meet daily to discuss and develop patient care together. The use of the EPIC electronic health record, which is accessible to all members of the team, will be used as a tool for measuring goals. Communication strategies that will be used to develop and encourage participation in and lead the interprofessional team will include the use of the nursing handoff in the patient's electronic health record to clarify nurse-to-nurse communication, the situation background assessment recommendation, also known as the SBAR tool, to enhance communication between the providers and nursing, pre- and post-education testing during the education phase, encouraging feedback as to how the project is progressing in order to make corrections and improvements, and sharing the success through staff meetings, emails, posting the results, and face-to-face conversation among all members of the team. In summary, collaboration across disciplines allows healthcare professionals to bring their particular expertise and experience to influence and manage today's healthcare issues. By offering differing perspectives between professions, innovative solutions can be found. When permitted to function to the full extent of their practice, nurses are uniquely qualified to lead interprofessional collaboration. Nurse leaders are highly suited to encourage and sustain interprofessional collaboration as a reflection of their experience, knowledge, education, and skills. Without IPC, the proposed evidence-based change in practice discussed would not be successful. The triple aim of improving patient experience and satisfaction, improving the health of populations, and reducing costs is not attainable without IPCs. Nursing leadership is integral to creating a motivated team and reaching the ultimate goal of the healthcare mission of the organization and healthcare in general. Thank you for listening.